Hi, it's Dr. Mabourakh from Folsom Plastic Surgery. Today I want to talk about different nasal implants. Let me tell you first that I do not use nasal implants. I think they're a huge problem. When there is time for reconstructions, I prefer to use your own tissues. We can get cartilage from the septum, we can cartilage from the ear, we can cartilage from the ribs. There are times that that's not available. There are other options to get different forms of cartilage. But recently, I've been seeing more and more patients come who have had their nasal implant augmentation performed in other countries, usually the Philippines, the Far East, Turkey, Thailand. It's easy for that kind of procedure, and these are typically Asian noses that don't have any nasal dorsum. There's just lack of tissue up here. How do you deal with that? Well, when you go to these foreign countries, it's a really quick surgery. So they usually put either a silicone rubber implant, or recently I had the patient come with this. This is a Gore-Tex implant. It's a horrible idea to use one of these. I want to show it to you because it was a hard time removing. This was infected. The patient came in with drainage from the nose. She's been seen in other locations. The emergency room, was placed on antibiotics off and on for a year until I finally saw her and convinced her this had to come out. So we had to go under general anesthesia to remove this. The problem with Gore-Tex implant, it's got little crevices, little holes. It's kind of a woven material, so tissue grows into it. Guess what? Bacteria grows into it. Well, you can't kill that bacteria with antibiotics. This was a horrible surgery to remove, but it had to be removed. We'll talk about reconstruction with my patient in about 6 months when the infection is cleared. Besides that, there's a photo up here of a silicone rubber implant that I removed. The problem with those implants, the same thing, they can get infected, but typically I've seen them come in, they erode through the nasal skin. This one was eroding through the skin, and I had to remove it. Whether that healed, and we'll go ahead and reconstruct again with cartilage. So these are two things that we see that are a problem. I just wanted you to know about problem with nasal implants. I hope that was informative. Thanks for watching.